The United States is facing a quiet but devastating healthcare catastrophe, and despite decades of warnings, we are still walking straight toward the cliff's edge. The doctor shortage is no longer a looming threat. It is a full-blown, systemic crisis unraveling in real time. Patients are already feeling the weight of this collapse, with wait times for specialist appointments stretching from weeks to months, and in many cases, the delay is not just inconvenient, it is deadly. Behind this crisis is a perfect storm of policy failure, demographic pressure, economic barriers, and political dysfunction. The research from Rochelle Walensky and Nicole McKen only scratches the surface of a far deeper rot in the American healthcare infrastructure. If the current trends continue, the future may hold an unrecognizable and dangerously fractured system in which access to timely medical care becomes a luxury rather than a right. Let's start with the numbers. The National Center for Health Workforce Analysis projects a staggering shortfall of 140,000 physicians by 2036. That number isn't just a bureaucratic estimate, it's a blueprint for disaster. And it doesn't even begin to account for the disproportionate distribution of that shortage. In rural and underserved regions, the crisis is already acute. Rural America is expected to experience a 56% shortage of physicians, compared to just 6% in urban centers. That means entire counties may go without specialists or even general practitioners for years at a time. These aren't abstract figures. They translate directly into lost lives. The pandemic revealed how fragile the system already was. Amid the chaos of COVID-19, patients died of heart attacks because they couldn't get into emergency rooms. Cancer screenings were delayed, sometimes indefinitely. Intensive care units buckled under pressure not just from the virus, but from an inadequate staffing system that had been overworked and undersupported for years. We are now watching that same level of system strain return, not because of a virus, but because the workforce is simply collapsing. Even before the pandemic, 80% of U.S. counties had no infectious disease specialist, an appalling figure in a world where outbreaks are becoming more frequent and more complex. It's hard to describe just how dangerous that is. Infectious disease specialists are the front line of defense in the next pandemic. Without them, we will be flying blind the next time a dangerous pathogen spreads. This problem didn't appear out of nowhere. It is the direct consequence of short-sighted policies that gutted medical school capacity, capped residency slots, and failed to respond to demographic shifts in a timely manner. The Flexner Report of 1910, once seen as a landmark improvement in medical education, had the unintended consequence of shuttering medical schools in many parts of the country, creating permanent medical deserts. Then, in the 1980s, based on incorrect predictions of a physician surplus, Congress capped the number of residency positions, creating a bottleneck that still exists today. Incredibly, reversing this cap requires an act of Congress, something that is yet to materialize in any meaningful form. Meanwhile, the population continues to age. By 2050, the number of Americans over the age of 85 is expected to triple. These individuals require complex, time-intensive care that our system is simply not equipped to provide. Chronic conditions like diabetes, dementia, and heart disease will become more prevalent, while the number of available physicians shrinks. This is a formula for widespread suffering, especially for those in marginalized communities who already face barriers to care. And yet, instead of mobilizing with urgency, the system seems to be idling. Training a doctor takes 7 to 10 years. So, any changes we implement now won't yield results for nearly a decade. We are already behind, and unless something changes immediately, we are locking in a future where millions of Americans will go without adequate care. The problem is further exacerbated by a troubling new trend: physicians choosing not to practice in states with restrictive healthcare laws, particularly those limiting abortion access. Following the Dobbs v. Jackson decision, states that eliminated or heavily restricted reproductive health care are finding it harder and harder to attract young doctors. Surveys show that more than 80% of medical students would rather train and work in states that support abortion rights, not just for ideological reasons, but because they want access to full reproductive care for themselves. And since 20% of physicians are married to other physicians, that decision has a multiplier effect. It's no coincidence that many of these same states also have some of the lowest health outcomes in the country. Mississippi, for example, has a life expectancy 6 years lower than Hawaii, and it ranks near the bottom in physician density. That correlation is not subtle. Fewer doctors means worse outcomes. More people die unnecessarily. More children grow up with chronic conditions. More elders live their last years in pain without adequate support. So, where do we go from here? The solutions are complicated, but the first step is brutally simple. Admit that we are in a crisis. Pretending this is a future problem delays the urgency that this moment demands. We need an immediate, coordinated federal response that addresses the medical education pipeline, expands residency slots, and provides massive incentives to recruit doctors into high-need areas. Student loan forgiveness for those who serve in rural communities, higher salaries for primary care physicians, and streamlined medical training paths are not radical ideas. They are necessary. We must also address physician burnout. The bureaucratic demands placed on doctors are absurd. Mountains of paperwork, inefficient digital systems, and increasingly corporatized healthcare environments are driving good physicians out of the profession entirely. AI may help with this burden, but technology alone cannot save a system that is bleeding talent. What we are watching is the slow unraveling of a core pillar of society. A country without doctors is a country where pain is normalized, where illness goes unchecked, where preventable deaths become common, where your zip code determines not just your quality of life, but whether you live at all. If we don't act now, the doctor shortage will become irreversible. It won't just strain the system, it will break it. And when it does, there won't be enough time left to fix it.